Yes, please go right ahead. West Clara, please be here.
Deputy President and all the guests, thank you for this opportunity to address a few issues that are affecting the healthcare workers and the health sector. I'm a union member of the Kenya Union of Clinical Officers Vihiga chapter. I'm the Deputy Vice Chair. So, I want to say, my name is Walter Adoli. So, I have a plea to the leadership. Vihiga County, after 10 years of devolution, we still do not have a level 5 referral hospital. The residents of Vihiga County are forced to seek services in the nearby Jaramogi Oginga Odinga, or they have to go all the way to Eldoret, or at times they end up at KNH. Let it be noted that when you visit KNH, you will find that it is only people from Vihiga County who are still seeking services there. It is a shame, and we are not asking for much. The hospital that we have was built by the late President, Daniel Arap Moi. So I feel like we should take a challenge and be better, because we are the living now. Moi should not wake up and say, okay, I built this one, and you who has been living for the last time since I died, what have you done? So our plea is very simple. It is high time in Vihiga we deserve to have a level 5 hospital. 2, I want to talk about the supply of health commodities. These residents of Vihiga County, up to now, they are purchasing medication using their own funds. When they are asked, they are told that healthcare workers have stolen. I'm a representative. We are not stealing. Those medications are not made available. At this time and this period, in this century, it is very sad that our hospitals do not have medication. So why then build the hospital? If it does not have medication, don't build it. So, even before we build the referral, but we have to build it at anyway, let us equip the health centers, let us equip the dispensaries, so that the work at the referral becomes easier. And then I want to talk about the issue of human resource. About the healthcare workers in Vihiga, we have a real challenge. Smeha here is a witness. He's aware of the issues. We've gone up to court. Sons and daughters of this region were employed in the year 2019. 2019, they stayed 2 years without pay. We have gone to Senate. Senator Wetangula here was a participant in a meeting held at SOSA. Senate promised us they are going to give us a feedback after 2 weeks. They did not give us a feedback. Up to now, it is very unfair. So my plea to the leadership, kindly look into that issue. And then I want to talk about the college, KMTC. KMTC set up a college to train healthcare workers who are going to take care of the residents. The KMTC is still having challenges in terms of infrastructure. They do not have anywhere they can call like a permanent place of their own. I have seen it being done in other counties, whereby KMTC provides the needed human resource, and the local leadership provides land and infrastructure. So our leadership, this one is not for the Deputy President, our leadership, our members of parliament, our women rep, our members of the county assembly, we deserve a college in our area. Because every other county has a college. So that's where our children, our brothers and sisters are going to go to. So that's a challenge to our leadership. Now, a little bit political. This is to the earthquake himself. I'm proud of your decision. And to the hustler. I have been to Uasin Gishu County, and I want to say that Uasin Gishu County is among the leading counties in terms of health investment. There are like all types of medics and professionals in that county. So this partnership between the earthquake and the hustler should trickle down to us, bottom up, right? So hustler, wakati unatembea na Mheshimiwa Musalia Mudavadi, kindly show him this is how we do it. We want to see it. That this partnership should, I encourage it. With those few remarks, thank you.
Thank you very much. Walter, yes. I have a few questions for you.
We already provided equipment of about 800 million shillings for a level 5 hospital in Vihiga. Maybe we need to have a discussion with the county on what are the real challenges. Why don't we have a level 5 facility in Vihiga when, like all other counties, we provided for equipment, ICU equipment, renal equipment, radiology equipment that would actually equip a hospital and make it level 5. You have given me some homework. I will go and do some homework to find out exactly what happened. Number two, I want to ask you as a health professional, what are your thoughts about the National Hospital Insurance Fund? What is its impact now, and what do you think we need to do going forward? Do you have any ideas?
Thank you for that question. National Health Insurance Fund, NHIF, is I would say, for our people. But the challenge that we are having is this, that one, our people are not able to raise the premiums of 500 shillings. It's a challenge. And what makes it matters worse is that without having a level 5 hospital, because these services are offered in terms of levels of hospitals. So you find that we have a patient, yes, wants to access NHIF, but then they have to go to travel. And now when they travel to these hospitals, unapata ya kwamba they have to take care of other needs. So still, NHIF, I've had a suggestion. There was something about making it that those to raise the premiums for those who are employed, so that it can cover for these others. I don't know how it can work, but if it can be bettered, what I can say, just bettering the NHIF will try to ease the burden of cost. Because our people basically, when they are here, if they happen to fall sick, they're going to sell that small piece of land that is there. And it may not fetch enough. So if there's a way that NHIF can be bettered to take care of everybody, and then these services that we are requiring for NHIF be brought near to the people, it will be much better.
Okay. For clarity, so you would want NHIF to the reach so that it can get to as many people as possible. That's one. Yes. You're also talking about the premium. Yes. That there are people who may not afford the 500 shillings. Yes. Right? And therefore they fall back, and therefore they have challenges accessing the facility. Yeah. And then are you saying that if you go to a dispensary or a health center, you can't be treated using your NHIF card, even if you have it?
On the ground, NHIF, you can only use it at our referral hospital, Mbale. But at the health center level, at the sub-county level, you cannot get services. On top of that, I had forgotten something. There is the non-communicable diseases. Diabetes, hypertension, they are there in our communities. However, you find that for NHIF, it's more of limited in terms of covering for those illnesses. The government tried to put in place the non-communicable disease clinics. If you go to the health centers, if you go to the dispensaries, yes, what we do, we are able to attend to the patients, but they have to buy medication by themselves. So if non-communicable diseases can be covered, and then these drugs are made available in the facilities, it will ease the disease burden in the community.
Thank you.
Yeah.
Thank you, Walter.
Thank you.
Thank you.
As Clara comes to make her point, Your Excellencies, kuna vijana wawili, Alex Huya and Eliakim Makanga, who will make brief points, one at something more on border, another one on technical training. Alafu, we will just have two people, that is Archbishop Patrick Lehanda and Archbishop Albert Obede on the religious sector. Alafu tutamalizia na mzee John Ball kupeana vote of thanks. In that order. Thank you, Clara.
Good afternoon, Dr. William Ruto, Honorable Mudavadi,